Hello dear students, I'm here to make a video on the larynx, the anatomy of larynx. Basically, larynx is very important topic and you will read it in ENT also during first year MBBS. These are the competencies which has to be covered. Describe the morphology, identify structure of wall, nerve supply, blood supply, actions of intrinsic and extrinsic muscles of larynx, anatomical aspects of laryngitis and anatomical basis of recurrent laryngeal nerve injury. And I'm going to deal with all these headings here. Now if we see what is larynx, larynx is sitting on lower respiratory tract and is part of upper respiratory tract. Upper respiratory tract include the nose, the nasopharynx, the oropharynx and the larynx. And it acts as a watchdog of the lung. Like except air, nothing can enter into the trachea and lung, and also produces the voice, that is also known as voice box or the organ of phonation. And as you see, like when you blow air through the whistle, it passes through the expiration, and there are two small flaps within this vessel which vibrate when the air is passing out, and that's how the larynx work. That is, the phonation is produced during the expiratory phase. And you see, it is also known as index of intellect. Basically your phonation is index of intellect. Now you see, these are the lungs, and the air from lungs in expiratory phase passes through trachea, passes through larynx, and the vocal cords will produce sound, and that's how the phonation occurs, and it acts as a watchdog. Nothing enters rather than air here. Now in next you see where it is present. It is present in midline of the neck, and extension, if you see, is from epiglottis to start of trachea or the lower border of the cricoid. Now what are its function? It allows air passage, phonation, and act as a watchdog, and during degglutination it moves up and down, so it helps in degglutination. So what is Adam's apple or laryngeal prominence in males? You see that there are two thyroid lamina which meet each other at an angle, and that angle is very prominent in males and also known as Adam's apple, and in females this angle is about 120 degree. Now here you can see this is a male, and this Adam's apple or laryngeal prominence is quite prominent, you can see here. And what happens during puberty? If you see, during puberty male larynx suddenly grow very rapidly, and this laryngeal prominence is formed, and the sound of these boys become low pitched and very loud sound. Now if you see the vertebral extent of this larynx in adult males, it is from C3, C4, C5 and C6, but this is not the case in case of females. It extends from C1 to C4 also in infants and children. Now you see here, this is the epiglottis and this is the laryngeal inlet, and we have entered in the cavity of larynx. This is the sinus of larynx, this is the cricoid cartilage. And here you see this area is nasopharynx behind nose, oropharynx behind oral cavity, and behind larynx this cavity is known as laryngopharynx. Now extent we already have seen, but as large, if we see, the male larynx is longer, broader, and also AP diameter is larger. So 45 millimeter long, 43 millimeter broad, 36 millimeter AP diameter in males, while in females you see it is 36 millimeter, 41 millimeter and 26 millimeter long, broad and AP diameter respectively. And we have talked about this. So what are the constituents of larynx? You see the skeletal framework of cartilages along with joints, ligaments, membrane, is forming this larynx as a whole. There are 3 unpaired and 3 paired cartilages, and if this larynx has been, when it has been formed, you will see the innermost lining will be the mucous membrane, and after that you will see the fibroelastic membranes and the muscles and extrinsic membranes in the cartilages. We'll see later. Now, what are the cartilages? 3 paired cartilages are arytenoid, corniculate and cuneiform, and unpaired are basically UP-TEC, that is unpaired. TEC is thyroid, epiglottis and cricoid. If we see the type of cartilages here is hyaline, mostly in thyroid, cricoid and basal part of arytenoid, and they ossify about 25 years of age, and while epiglottis, corniculate, cuneiform and upper part of arytenoid is elastic, so it does not ossify. And you want to see the different cartilages, you see it is a shield like thyroid cartilages, 1 lamina, 2 lamina, and these 2 join at angle, and here it is prominent. Now the ring shape, this is the only cartilage which is complete anterior posteriorly. You see this is the posterior aspect. This will be known as lamina of cricoid cartilage. Anteriorly this thinner part is known as arch, and this leaf shaped cartilages will be epiglottis. Now you can see in this diagram, this is thyroid cartilage, this is the laryngeal prominence, this is hyoid. Hyoid is not part of larynx, and it is the only bone which is not connected to any other bone by any joint. Now here you see the anterior part of the cricoid cartilage, which is quite thin. It is also known as arch, and posteriorly you can see the broader part that is known as lamina, and all other cartilages are deficient from posterior aspect, they are not complete. This is leaf shaped epiglottis, and you see on superior border of cricoid cartilage is sitting this triangular cartilage that is known as arytenoid. On arytenoid there is corniculate cartilage, and if we want to see where is cuneiform, so this is cuneiform. This is the sagittal section of the larynx. You can see this is the anterior part, anterior part of the thyroid cartilage. The posteriorly, if you see, the thyroid cartilage is extending as superior cornu, inferiorly inferior cornu. And now this is the arytenoid sitting on the superior border of posterior lamina of the cricoid cartilage, and here you see this is the corniculate, and anteriorly this rod shaped cartilage is known as cuneiform. So if we talk about this very important part here, this is the thyroid cartilage, and this is one of the lamina shown here. This is the oblique border, oblique line of the thyroid cartilage, and when we were studying the thyroid gland, we saw that the apex of the thyroid gland was not extending above that, and it was sandwiched between few muscles. So what were those muscles which were attaching on the oblique line? Basically this is the inferior constrictor muscle of the pharynx in 2 parts here. Thyropharyngeus and cricopharyngeus has been shown, and you see the one muscle which is coming from hyoid towards this oblique line is thyroid. The one coming from sternum and attaching on this oblique line, this muscle is sternothyroid muscle. So you see on oblique line these many muscles are attached. You see on the posterior border there are the longitudinal muscles of the pharynx attaching here, palatopharyngeus, the salpingopharyngeus and the stylopharyngeus. One more muscle which you get to see externally, which is intrinsic muscle of the thyroid, is cricothyroid muscle, and it is the tensor. And you see one thing I forgot about cricoid cartilage, it is the foundation stone of the larynx. Now you see on posterior aspect of the thyroid cartilage, these are few dots shown here. This upper green dot is thyroepiglottic ligament, where this leaf is attaching, leaf-like cartilage is attaching to the thyroid, and this is thyroepiglottic ligament. There are vestibular ligaments and vocal ligaments, 2 muscles, the vocalis and thyroarytenoid muscles. You will later get to see how these are attached here. Just remember this, these are the few important attachment, and you see this posterior cricoarytenoid attaching on the posterior surface of the lamina of the cricoid cartilage. The similar diagram has been shown here just to add on that this is the superior border of the thyroid cartilage where thyroid membrane is attaching. Similarly here the cricothyroid membrane will be attaching, and here you see all the palatopharynges and salpingopharynges we have talked about, so I'm not going much detail of it. So now just to see in lateral aspect, this is your leaf-like epiglottis. This is the anterior aspect of epiglottis. This is the posterior aspect of the epiglottis, and here is this hyoepiglottic ligament. And now you see this epiglottis is basically closing the inlet of larynx and opening the inlet of larynx. So every epiglottic muscle will be closing, and it is pulling it back and will be closing the inlet, and thyroepiglottic will be opening the inlet. So later in muscle part you will see this. Now cricoid cartilage, if we see, is this is anterior arch, this is the posterior lamina, this is the arytenoid, and arytenoid has muscular process, and the vocal process on its pegs is corniculate. Now you see the muscular process giving attachment to posterior cricoarytenoid and lateral cricoarytenoid, and now here you will see from vocal process the vocalis muscle is attaching. Later also we will discuss this. Now the paired cartilages we have talked about, the arytenoid, cuneiform and corniculate. Arytenoid, the two processes we have talked about. This was the apex, this was the base, this is the anterior surface, anterolateral surface, this is the posterior surface, and here you see this is the medial surface and this is the lateral surface. Now on vocal process is the vocalis muscle, you have seen the vocal cord will attach. In the muscular process different muscle will be attached. When they move, they always move in opposite direction. When muscular process will move medially, this vocal process will go laterally. That's how the it functions. Now what are the laryngeal joint? Very easy to understand. You see these are the cricothyroid, cricoarytenoid and arytenocorniculate joint. So cricothyroid, very easy, you can see the inferior cornu which is articulating with the cricoid. So this is cricothyroid joint. What about the cricoarytenoid joint? So this joint is cricoarytenoid joint. Now arytenoid and corniculate joints, this joint is arytenoid and corniculate joint. These are all plain synovial joint, and basically the cricothyroid and cricoarytenoid are plain synovial and provide rotatory and gliding movement. A bit of these movements are performed here, and arytenocorniculate joint is not very significant. So this is the diagram. Now we will see the membranes and the ligaments of the larynx. Extrinsic membranes, the thyroid membrane, the cricothyroid, the cricotracheal and hyoepiglottic membrane, you can see here from anterior aspect, from posterior aspect, and from lateral aspect. Anterior aspect, this membrane which is seen externally is thyroid membrane. Thyroid membrane is showing three thickenings. This is the medial thyroid ligament, the lateral thyroid ligament. In lateral thyroid ligament, in upper part you will see P-shaped elastic cartilage, very small elastic cartilage, and that is known as cartilaga trapetia. Now this membrane which is between cricoid and thyroid is cricothyroid membrane, and also the cricothyroid ligament. You can see here the last is cricotracheal membrane and ligament. So these are the externally placed ligament. One hyoepiglottic ligament, I guess I haven't shown you. Yeah, this is hyoepiglottic ligament. Now we are moving to the next, that is intrinsic membrane. These are basically the sheet of fibroelastic membrane or tissue which is present, like if we move from inside out, the first will be the mucous membrane, then will be this fibroelastic tissue. So the fibroelastic tissue is in form of two areas, the quadrangular membrane, the cricovocal membrane. There will be gap between these two. They are deficient at one places, that will be known as sinus of larynx. Now the quadrangular membrane will be thickening to form vocal ligament, vestibular ligament, and cricovocal will be thickened to form the vocal ligament. How? We will see now. So I think this was very simple, and I haven't told you that in thyroid membrane there is opening for superior laryngeal vessels and internal laryngeal. Now this is very commonly asked questions during Viva. Now moving to the internal membrane, if we see the cavity of larynx, we cut it and we see the cavity. This is the area of epiglottis from inside. You see on posterior aspect the epiglottis covered with the mucous membrane, and after mucous membrane this pink layer is basically fibroelastic membrane. Here the white layer is fibroelastic membrane, then comes the muscle and the cartilages. So we are going to talk about this membrane. This is quadrate or quadrangular membrane. You see it is extending from, this green membrane is extending from epiglottis to arytenoid here, and so this membrane is like this on left side, and right side also there will be this membrane. So this is the upper margin of this quadrangular membrane which is forming airy epiglottic fold, and this is the lower margin of this quadrangular membrane which is forming the vestibular ligament. So if you see, this is the upper margin and this is the lower margin. So the lower margin where this pointer is, this is the lower margin, and this is forming the vestibular ligament. Now you see the pink color mucous membrane is passing over it to form the vestibular fold. Similarly, this cricovocal or conus elasticus membrane is attaching to cricoid, and it is thickening in upper part to form the vocal ligament. Now the mucous membrane is passing above it, forming the vocal fold. So you see this is the quadrangular or quadrate membrane. This is the posterior border which is free, forming airy epiglottic fold. The lower border thickens to form vestibular ligament or false vocal cord. Similarly, this is conus elasticus, and it is formed, its upper margin is thickening to form the vocal ligament. When mucous membrane will cover this, this will be known as vestibular fold or false vocal cord, and this will be known as vocal fold or true vocal cord. And you see these membranes are not continuous with each other, there is a gap in between. So this is known as sinus of larynx. This gap is basically the space between vestibular fold above and vocal folds below. Now you can see this is the quadrangular or quadrate membrane attaching to the epiglottis, and this area will be airy epiglottic fold. This area is airy epiglottic fold, and this is vestibular ligament and cricovocal membrane forming to thickening to form the vocal ligament. Now vestibular and vocal fold you have understood. This exact area, this fold is basically vestibular fold, and this fold is vocal fold. Now this vestibular fold, this vestibular fold, this vocal fold, and this vocal fold, this area between these is known as the sinus of larynx. True and false vocal cord we have seen. Now you see this is true vocal cord, basically the vocal ligament with mucous fold, and the false ligament is false vocal cord is vestibular ligament with mucous membrane. Now the sinus of larynx or the sinus of larynx is extending laterally and anteriorly. This is known as saccule of larynx. And now if we take a section, coronal section, just to see this, and this you can see this is the sinus of larynx, and it is extending towards the thyroid lamina, thyroid membrane. This is known as saccule, and in this area you will see lots of mucous gland. It is also known as oil cane of larynx. Now if you see the mucosa of the larynx, how it is attaching to different places, so it is tightly adhered at the level of vocal fold, and except most of the places it is loosely attached, but this is area of significance. Here it is tightly adhered. Now we'll see later in detail. First we see the partitions of the laryngeal cavity. So all of you know this is the sinus of larynx, these are the vestibular folds. Now between these two vestibular folds there is this slit like gap anteroposteriorly. This is known as rima vestibuli. Similarly, in between the vocal folds anteroposteriorly, this is slit like gap that is known as rima glottitis. Now above these vestibular folds, this area is known as supraglottic compartment. This is basically glottic compartment. and this is infraglottic, yani from vocal folds to this area, this is known as infraglottic compartment. So understood, there are supraglottic, sinus or ventricle of larynx, and the subglottic or infraglottic compartment. These are the compartments. Now we haven't talked about the inlet of larynx. If we see, this is the inlet of larynx, this whole area. This anteriorly in inlet you will see this is epiglottis. On lateral aspect you will see these are airy epiglottic folds, and posteriorly you will see there is interarytenoid mucus fold. So if we draw this simple diagram as given in your BDC, the inner aspect is lined by this pink layer, that is mucous membrane. This green is quadrangular membrane, and where this pink and green are together is known as vestibular fold. Similarly, this is green conus elasticus, and this pink layer passing above it is vocal fold or true ligament, true vocal cords. Now here you are able to see very important thing, this black area, this is known as pyriform fossa. So sometimes the pyriform fossa is asked as a short note. So this area basically you can see where the forceps is kept. Now this is hyoid, this is thyroid. There must be a membrane which is broken here. This is thyroid membrane. This is also part of thyroid membrane. So thyroid membrane, and this area is basically inside, from inside if you see the area of quadrangular membrane. So between quadrangular membrane and thyroid membrane, this area is known as pyriform fossa or the smuggler's fossa. And if you talk about the mucous membrane of the larynx, it is loose all of the places except I told you the area of the vocal cord, which was very important, and also at the level of cuneiform and corniculate. So this vocal cord area is looking pearly white, because here the mucous membrane is tightly adhered, and during laryngitis also you will see inflammation is not extending to vocal cord. So the laryngeal cavity we will see is mostly lined by ciliated columnar epithelium, except at epiglottis anterior aspect and upper part of the posterior aspect are lined by the stratified squamous epithelium, including the epiglottic fold and vocal folds. And numerous vocal glands are present, numerous mucous glands are present on surface of epiglottis and saccule, and vocal folds has no mucus gland. So this was the area which was lined by stratified squamous epithelium extending to the upper part of the posterior surface. Rest is ciliated columnar epithelium in case of epiglottis. Now if you are in ENT department and you are asked to do the indirect laryngoscopy, this is a handle of the mirror, and this is the mirror which is inserted after pressing down the tongue. Now you will see few structures in this mirror. So this structure here you see is the anteriormost is known as tongue. This is the base of the root of the tongue, which is connected to epiglottis by median and glossoepiglottic fold. There were lateral glossoepiglottic fold. This area is vallicula, this area is vallicula, this is epiglottis. Now the white color pearly structures are the vocal cords. Now these are vestibular cord or vestibular folds on each side. So midline you will see the vocal cord, just lateral you will see the vestibular. These are the areas of arytenoid, and this is interarytenoid fold. And if you want to see exact what lies here, so the dorsum of the tongue here, median glossoepiglottic fold, the epiglottis, the vocal cords, the vestibular folds, the airy epiglottic fold, the corniculate and cuneiform here, and the rings of the trachea seen here. What is glottidis? This is basically the narrowest part of the laryngeal cavity. So we have seen there were two folds, the vestibular folds, the vocal folds, and between these two the space was sinus of larynx. But if we talk about between right and left vocal fold, the space between right and left vocal fold or true vocal cord is known as glottidis. And if you see, this is one vocal fold, this is another vocal fold, this is, say, this is right side, this is left side. So this anteroposterior slit like area is known as glottidis. So anteriorly it is bounded by thyroid cartilage, and on sides you see there are interarytenoid, behind it is interarytenoid fold of mucous membrane, and on sides you will see the vocal folds, and interior 2/5 the vocal folds are membranous, and the vocal process of arytenoid in posterior 1/5 is forming the side or the lateral boundary of the rima glottidis. So now you see this area is rima glottidis, this red line is membranous part, and this is vocal process of arytenoid. So if short note comes, so this area has to be noted as rima glottidis. Now what happens, rima glottidis is very helpful during phonation. The membranous part will when adducted will be producing the phonation, and this cartilaginous part has to be opened for the process of respiration. So in quiet breathing you see the membranous part is triangular and this area is quadrangular. As a whole rima glottidis looks like pentagonal. During inspiration what happens, the abduction has to take place, so this muscular process will, the posterior cricoarytenoid will act, so muscular process will be moving towards each other, so the vocal process will go away from each other, leaving this area a bit bigger and the air will pass. Now during inspiration this has happened. Now during high pitched sound what do we need? Adduction is required whenever we are producing sound. The cricothyroid has tensed these vocal cords enormously, and that is the high pitched sound is being produced. And this is during the whispering, the air has to pass, the total adduction is not there, and you can see this area is also widened up, this is funnel shaped. So these are few important things. Rima vestibuli is basically the space between two vestibular fold, and rima vestibuli will permit air entry during inspiration, and the vestibular fold prevents air exit in expiration, so food cannot go to the larynx. Now the laryngitis is basically infection of larynx, and during this also you can see the pearly white vocal folds because of tight adherence of mucous membrane here, and this is epiglottis you see. And now what is singus nodule or screamer's nodule or teacher's nodule? Here you see this is vocal cord, the membranous part, and here is the vocal process of arytenoid. And these vocal nodules, because of constant friction between these two, will develop at anterior 1/3 and posterior 2/3 junction. These are known as vocal nodules or screamer nodules or teacher's nodules. Laryngocele is basically trumpet blowers who have been doing this job since very long. The saccule can extend till thyroid membrane but not seen externally, will be known as internal laryngocele. Once this reaches outside, not piercing it, the forcing the thyroid membrane out, and the swelling will be seen in neck. This is external laryngocele. What is laryngeal obstruction? Heimlich's maneuver everybody is aware of, like you are in a restaurant and someone chokes, so laryngeal inlet or the rima glottidis, some foreign body goes, then what do you have to do? You have to give upward thrust so that the residual air in lungs passes with the force and the foreign body gets out of the larynx, and that's how choking is prevented. So now